So if you can highlight on the ecosystem bit, you already mentioned that the insulin not coming in, so the glucose is not being absorbed by the cell and energy is not being formed, and it is having its effect on various body parts. So diabetes actually affects many more diseases than just diabetes alone. So what would you like to say about this?
Every system of the body. It is, when we were students, our teachers told us, if you know syphilis, you know the medicine, because syphilis will affect every system of the body. Now syphilis is gone. Now everybody says if you know diabetes, you will know the whole body. So if you say from the brain to the eyes, to the heart, to the lungs, to the liver, pancreas, intestines, sexual organs, bones, muscles and nerves and kidneys, everything is affected in some way or the other. But primary attack of diabetes comes on the kidneys, nerves and eyes. 3 primary attack organs. And foot, of course it includes nerves and the blood vessels. And equally important attack will come on the heart and the brain, as a heart attack and the stroke. So these 5 primary attack organs, and then subsequently several other systems which are. So a patient comes to me with some other problem. He thinks it's not due to diabetes. It's most of the time is somehow related to diabetes.
Right, right. So by the time the symptoms surface, it usually becomes too late to reverse the effects of diabetes. So how does one detect early? I mean, how do if somebody comes to you and you find that he might be having a problem, but the source is diabetes. So is there any way for early detection?
Oh, absolutely. In fact, we always say that if a lay person can remember what are the various factors which lead to diabetes, then early detection is very much possible. So let me just enumerate some of the factors for you. We have already said increase in the weight, increase in the abdominal circumference, so people who are totally sedentary, not doing anything during the day, just sitting, desk job, not exercising enough, not taking enough fruits and vegetables, then the mothers who have given birth to a baby which is more than 4 kg at the birth time, people who have blood pressure, people who have some sort of a cholesterol problem, people who have heart disease, all these are at increased risk, and Indians as a race are at increased risk. Now there are certain other things which a non-medical person can see in a person, say, well, this person may be having diabetes. Very interesting. Excess fat below the chin, double chin. So you can identify, anybody can identify a double chin in any person. There is a dark pigmentation at the back of the neck, which is called acanthosis nigricans. So if you see the neck and there is excess fat here, and the dark pigmentation at the back of the neck, this person is a high risk for developing diabetes. So whenever we tell a person, person asks, well, what should I see in a person to see? Our students, we tell these are the things that you should see in a person. Now, if a medical person is examining a patient, then what could be other things that lead to increased risk for a liver which is enlarged. So one can see liver with the hands, a trained person. If liver is enlarged, our research has shown that more than 15 centimeter of total liver, almost 5 times more risk for it. So these are some of the things which are emerging from our own research.
Right, right.
And we have done plenty of research like this, where we have said, well, this is the thing that you should look for.